What if the key to understanding yourself lay not just in your personal history, but in a shared human memory stretching back thousands of years? Meet Carl Jung, the Swiss psychiatrist whose ideas expanded psychology beyond the individual mind, weaving together myth, culture, and personal growth. Born in 1875 in Kesswil, Switzerland, Jung grew up fascinated by both science and spirituality. He trained as a physician and specialized in psychiatry, where he developed a deep interest in the workings of the human mind. In 1907, Jung met Sigmund Freud, who became his mentor and close collaborator. For years, the two shared ideas and respect, but eventually their visions for psychology diverged, leading to one of the most famous splits in the history of the field. Jung agreed with Freud that the unconscious mind plays a powerful role in shaping behavior. But while Freud focused on repressed desires and early childhood, Jung saw the unconscious as far more expansive. He believed in two levels: the personal unconscious, containing an individual's forgotten memories and experiences; the collective unconscious, a shared mental blueprint inherited by all humans, containing universal symbols and themes he called archetypes. Archetypes, according to Jung, appear in myths, art, religion, and even our dreams. Patterns like the hero, the shadow, the wise old man, and the mother. These symbols, he argued, are not taught. They emerge naturally across cultures and history. One of Jung's most influential ideas was the process of individuation, the lifelong journey of integrating the conscious and unconscious parts of ourselves to become whole. In this view, personal growth isn't about suppressing parts of who we are, but about understanding and balancing them. Jung also introduced concepts that reached far beyond therapy rooms. His theories inspired the Myers-Briggs Type Indicator, MBTI, based on his ideas of introversion and extroversion, and psychological functions like thinking, feeling, sensing, and intuition. In his work with patients, Jung used techniques like dream analysis, active imagination, and exploring personal myths and symbols. He saw therapy as a partnership, a shared journey where the therapist learns from the patient as much as the patient learns from the therapist. While Jung's ideas were groundbreaking, they weren't always embraced by the scientific community. Critics point out that concepts like the collective unconscious are difficult to test scientifically. Yet his influence spread into literature, film, religious studies, and even pop culture, shaping how we think about meaning, identity, and the deeper layers of the mind. Jung once said, "Who looks outside dreams. Who looks inside awakes." This captures his belief that true understanding comes from turning inward, exploring not just the stories of our own lives, but the timeless stories humanity has always told. Today, Carl Jung is remembered as the psychologist who blended science with myth, reason with imagination, and the individual with the collective. He didn't just ask, "Why do we act the way we do?" He asked, "What greater story are we a part of?"